Alright, very good morning to Dr. Razi. I'll be presenting or critically evaluating an article on the efficacy and safety of ginkgo biloba standardized extract in the treatment of vascular cognitive impairment (VCI). It's a randomized double-blind placebo-controlled clinical trial. Alright, so the first question that I would actually refer to is, did the study address a clearly focused research question? My answer is a yes, because it's seen in the abstract where they have actually clearly stated they want to determine the efficacy and safety of ginkgo biloba extract in patients diagnosed with VCI. It's also found the introduction at the end of introduction where the aim of the study was to determine the efficacy and safety of ginkgo biloba in comparison with placebo in patients with VCI. So it's a yes, it's a clearly focused research question mentioned in this article. Number two, was the assignment of participants to intervention randomized? I would say it's a yes, because it's mentioned that the subject were randomly assigned using block randomization to randomize subjects into three groups with equal sample size, in which each groups received either 2 ginkgo biloba tablets, second group receives 1 placebo tablet and 1 ginkgo biloba tablet, and the third group receives 2 placebo tablets daily for 6 months. So the participants to interventions were randomized. Number 3, were all the participants who entered the study accounted for at its conclusion, in which were the intention to treat analysis considered? My answer is no. It seemed that at the beginning they have 90 subjects, but once drop out, and in the final the analysis only involves 58 subjects, which means excluding the dropout. So they haven't considered the intention to treat analysis or using the initial subject in their final statistical analysis. All right. Number 4, were the participants blinded? Were the investigators blinded? And were the people assessing blinded? So it's all yes. As we know, as mentioned earlier, the participants were randomized using block randomization. Then the principal investigator and the clinical staff were also blinded, in which they were actually inaccessible to the drug number or drug code number that was given to the participants. Okay, so it's a yes, they were blinded. Number 5, were the study groups similar at the start of the randomized control trial, in which the baseline characteristics of each study groups clearly set out? I would say yes, because each participant during the screening were actually recorded on their demographic data, presence of certain inclusion exclusion criteria, blood pressure, heart rate, respiratory rate, body temperature, etc. So yeah, baseline characteristics were clearly set out. Number 6, apart from the experimental intervention, did each study group receive the same level of care, or were they treated equally? My answer is a yes, because each subjects underwent the initial screening assessment. So once they have actually passed through the screening, and during the randomization or after the randomization, the placebo tablet was some sort identical to the ginkgo biloba tablet in terms of size, color, and shape. And each groups were actually invited to attend a total of 7 study visits in 30 days intervals during the 6-month study period. So that means, the follow-ups and the tablet given was similar. So that means the placebo and the intervention group were treated equally. Number 7, were the effects of intervention reported comprehensively? My answer is a yes. Power calculation was not recorded or was not being undertaken, but then the follow-up intervals were reported, like visit 1 for 7, so it's reported missing or incomplete data as nil. P-values were actually reported as well. So yeah, the effects of intervention reported comprehensively. Number 8, was the precision or the confidence interval reported? No, because it's not mentioned in any of the table in the results. Number 9, do the benefits of the experimental intervention outweigh the harms and costs? Yes, I would say that actually, um, so my answer is a yes, because it's mentioned in the article that adverse reaction were significantly more common and were more serious in the placebo group compared to ginkgo biloba, which seemed to be safe and with no serious adverse reaction compared to placebo. It's seen here that 9 of them in the placebo group had a serious adverse event, whereas nil serious adverse event noted in the ginkgo biloba group. So yeah, it's a yes, the experimental intervention outweigh the harms and costs. Number 10. Can the results be applied to your local population in your context? My answer is a yes, because the ginkgo biloba efficacy in treating VCI showed a statistical significant positive effects on CGI as the primary outcome indicator. Even though one was significant improved, out of 4 being studied, it's some sort a positive outcome when someone or individual consuming ginkgo biloba. Okay, so yes, it can be applied to the local population in your context. Number 11, would the experimental intervention provide greater value to the people in your care than any of the existing intervention? I would say I can't tell whether it's provides a greater value, because yeah, it only provides one significant result in their neuropsychological test, with adverse events were also noted. So yeah, I can't say whether it's ineffective or whether it's not effective and whether it's not safe. So I can't tell because of only one significant result being reported in this study. So yeah, that's all from me. Thank you.